Great. Well, thank you, everyone. My name's Chris West. Just by way of very brief background, I have a public and private sector background and a long history of helping start up and support social enterprises in both emerging economies and developed countries. Oh, sorry. Do you really? Lean. Is that better? Right. I'll just hold it. I'll tell you what. All right. Well, you didn't need to listen to the bit about me. So more important is I'm hugely privileged and honoured to have on the panel with me two colleagues here. I've got Lisa Kimber, who, as a founder and director of a social enterprise called LiveWell in Kenya. Lisa, in my experience of having worked with social entrepreneurs around the world, almost takes an accolade in my view, having a huge commitment and a massive tenacity to grow her venture to the position it has in terms of delivering primary and secondary healthcare to low-income communities in Kenya. So hugely privileged to Lisa coming all the way from Nairobi to be with us here and representing, if you like, the voice of the market. I'm also joined by Caroline Bresson, who's made a slightly less long journey to get here from one part of Washington, D.C. to here. Caroline is the Director of Social Investments at Open Road Alliance. Caroline can talk obviously more about what she's been doing, but again, a provider of rather innovatively structured finance to help the growth of social enterprises around the world in a number of sectors, including the healthcare sector. Now, I think I probably speak for all three of us in that we feel somewhat of oddities in this room in representing smaller organisations that are very directly related to people needing healthcare provision and services. And I think what we want to do in this session is really try and make it as participatory as possible. And let me start by saying, what we mean by social enterprise, and then I'm going to ask you a question. We define social enterprises as those organisations that essentially adopt a market-based approach to the provision of healthcare products and services to low-income communities. Now, they can be either not-for-profit or they can be for-profit. But what binds them all is that they have a social purpose in their mission statement. So they're very different to other types of organisations, for instance, pharmacies or clinics that clearly are businesses that serve such communities, but they don't have such an explicit social purpose in their mission. And I always find it interesting when people talk about the private sector, which is clearly the thrust of these next sessions. When most people ask, who is the private sector? Most people will think Medtronic, Shell, where I used to work for, BP, Philips. But actually, the private sector in most countries in the world, if not every country in the world, is not the big multinationals. It is small and medium-sized enterprises, where you go to the shops, you get your car serviced. It's the SME sector. It's pharmacies. So when we're talking about the private sector, as Amy Lynn quite rightly said yesterday, we must remember that the private sector is not the big multinationals. Even though much of the PPP discussion involves working with big multinationals, actually most people in the private sector do not work for a corporate. And if we disaggregate social enterprises, these are organisations with a very clear and explicit social purpose. So just to start off in a participatory way, I'm going to ask you a question. If we're here discussing the transition from the decline in public sector funding for healthcare and how this is going to be accommodated in the future, the question to you is, do you think social enterprises are going to play a trivial role in that provision of service, an important role, or I don't know? So I'm going to ask, who thinks, hand up, and this is a democracy, so everyone's hand has to go up, who thinks they're going to play a trivial role? Okay. Who thinks they're going to play an important role? And who doesn't know? Okay. I don't know either, actually. But what we're going to tease out is where we think there are opportunities. And really, just to set the scene before asking Lisa and Caroline to give their perspectives from both a provider of services and an investor in social enterprises. I just really wanted to give an overview of the social enterprise market by looking at Africa as simply one market, just to help frame what this sector looks like for everyone else. I've only got a few slides, so breathe easy. But essentially, if we define social enterprises not for profit or for profit, but with that explicit social purpose alongside the provision of market-based approaches, which essentially means you're selling something to someone, which is either the whole or part of your income stream. And as I say, we've conducted a market overview of all the social enterprises involved in healthcare provision in Africa, and I'll summarise that. But what's interesting is, why has this sector evolved really in the last decade? And I would posit there are three reasons for this. First of all, and I think it was alluded to yesterday, out-of-pocket expenditure on healthcare. People are willing and able to pay for good quality, affordable services and products. And so you're seeing a customer demand for affordable quality healthcare, and they're willing and able to pay for it. Secondly, you're seeing historically many not-for-profit organisations that relied on subsidies struggling to raise those subsidies. So and they're trying to accommodate the decline in income through essentially charging for products and services that previously were given away free or at discounted prices. So they are trying to adopt or integrate market-based approaches into what was traditionally just a not-for-profit service model. And thirdly, I would say younger people, which sadly are not anymore, but younger people, I think as a whole, are far more interested in business with a purpose, and therefore you're seeing many more younger people setting up enterprises with an explicit social purpose, but with a business mentality. So I think all those three reasons reflect why this sector is growing. If we segregate the 260 organisations that self-identify as social enterprises involved in healthcare provision in Africa, about half are not-for-profit, half are for-profit. So let's forget the legal structure for a moment, because I would say that's immaterial. They all have a social purpose, irrespective of legal structure. If we look at the issue focus of them, hugely diverse. Clearly, there are a lot very customer-focused, primary, secondary healthcare. But if we look also med devices, products, I think there's another session talking about the role of digital applications. Many of the digital applications at the moment are being provided by small and social enterprises. Technology, pharmacy models, finance, insurance has been mentioned, last mile distribution. So a broad range of healthcare product and service provision in Africa. But if we look at the stage of development of these, most, over 70%, are at what I would call the innovation phase. And innovation essentially means I've got an idea and I have a concept for what I want to do, but I haven't really done it yet. So it's very early stage. They're the majority of the 260. Then there are some that I would call early stage, where you've gone beyond your idea and you are generating some level of revenue from trying to deploy that model with your target market. There are less of those, 20%. And then those that I would say are more advanced, where there is a regularised income stream, there's some expansion going on, but they're not yet financially viable in a way that they're profitable. More of those. Those that I would say are operating in Africa at scale at the moment and are profitable are almost negligible, 1%. So that's essentially a framing of the market. If we look at the focus, where are these social enterprises in Africa? And these figures actually, while they're for healthcare, actually mirror pretty much the social enterprises across all sectors. There is a huge concentration in East Africa, with Kenya taking top prize. That's for various reasons, I would suggest. So East Africa, and to a lesser degree, Southern Africa. West and Central Africa, conspicuous by their absence. There are some, but they're very, very few. So it's highly concentrated in certain markets. What do social enterprises need to go through this transition to scale? And although the title of this session is, how do we catalyse and finance social enterprises, I would argue, as someone who's had a small business myself, that money is necessary but not sufficient. You need an enabling environment to allow you to operate and deploy a market-based approach, clearly. You need appropriate funding, and appropriate to the need of the organisation and in a form and term that is consistent with its ability to provide impact at greater scale. So I would focus on appropriate finance, and we'll talk more to Lisa and Caroline about what that means. Business and technical skills. We need capacity building. How do these organisations grow and develop those internal skills? And lastly, market linkages. How do small social enterprises connect with others, be they public sector or private sector or civil society organisations, to allow them to deploy their model better at scale? So although the title of this session is Access to Capital, I would certainly and try and keep in everyone's mind that money is necessary but not sufficient. If we look then at the level of support to these organisations, bearing in mind that most are at the innovation stage, I would be cheeky and say most donor money likes sexy innovation, and it goes to small-term projects, to things that are conceptual. So there is a lot of short-term project-based funding to ideas. Huge amount of support. If you look at those at scale that are generating revenue with predictability, rather strangely, there is a lot of commercial money out there looking to invest in them, with or without an intentionality to generate the impact alongside that. But you look at where this market is at the moment, the early stage and transitioning to scale, there is almost no support, be it money, skill support, or market linkages. So I would categorize the market in Africa, and I suspect this is fairly similar to other geographies as well, is it's vibrant, it's large, it's diverse, but it's early stage, it's hugely concentrated in certain countries, and there is a lack of access to appropriate funding and skill support to allow it to achieve its potential. We'll come back to whether that potential is sufficient to address the gap that we think will emerge. And I really want both Lisa and Caroline to make comments on that.